Today I'm joined by Dr. Mir Ali. Dr. Ali is a board-certified and fellowship-trained orthopedic spine surgeon for Morris Hospital Orthopedics and Sports Medicine. He's accepting new patients and sees patients at Morris Hospital Orthopedic and Sports Medicine's offices in Morris, Ottawa, and Joliet. We want to spend a little bit of time talking about back and neck pain. Is that normal?
I think that all of us who get past 30 or 40 years of life realize that our necks and low backs will never be like they were when we were 16. And so I think this is part of normal aging. I think most of us can live with it, but there are some things that concern physicians and healthcare professionals.
Okay, so it's basically, as we age, we should know that we're not what we once were when it comes to maybe back and neck, but it shouldn't be that bad or intolerable either, right?
I think most of us, 90% of us, find it manageable. You know, This is where I think a lot of us benefit from occasionally going to the chiropractor or going to our physician and maybe doing some physical therapy. But I would say the great majority of us find that neck or back pain, while not great, not perfect, is very, very manageable.
Okay. Well, what treatment options are out there to help?
Well, for just the wear and tear that we have in our low backs and our necks, a lot of the anti-inflammatory medications like Tylenol, ibuprofen, home exercises, maybe the occasional visit to a chiropractor are very helpful to keep those kind of, chronic lingering neck and low back pain kind of symptoms under control. But then once the pain starts going elsewhere, if it starts going into the buttocks, down the leg, or for the neck, if it starts going into the shoulders, shoulder blade, down the arm, those are things that are not normal, are usually more painful, and usually require a medical professional attention.
Okay. Well, what about like numbing and tingling in like fingers and toes and things like that? Can that be related?
Yes, and none of that stuff should be normal. Obviously, the more the pain kind of spreads from the neck, or spreads from the low back, those are all things that require medical evaluation. People can have numbness and tingling in their arms or even in their legs for many reasons, including neck or low back issues, so it's definitely important to get that stuff checked out.
All right, well, how does somebody know the best way to go when it comes to seeking some relief or some help?
Generally, most of us, have at least historically have had a primary care doctor who usually checks those kinds of things out for us. I think that the chiropractic care has a place, the physical therapy has its place for that chronic wear and tear, that chronic stiffness and kind of lingering pain that we get. But when the pain starts going into the arms, or the numbness starts going into the arms, or the pain starts going down the leg, or the numbness starts going into the leg, then I think it's important to have your medical doctor evaluate it and most likely send you to a spine care professional.
Very good. Anything else you want to make mention of before we wrap it up?
Well, I think the main thing here is that we have learned that pain medications are not the solution. In the midst of this opioid epidemic, we have a lot of concerns about treating some of these symptoms with pain medications, and I think even the medical healthcare professionals are realizing that throwing stronger and stronger pain pills at these things are not the solution. So the good news is that we have learned historically the lessons through the opioid epidemic of stronger and stronger pain medications. And then the second thing is that these surgical techniques to actually take care of nerve pinching in the neck and low back have become much more minimally invasive. So these two advances in the last decade of learning the lessons from the opioid epidemic about pain medications and the advancement in the surgical techniques have made a lot of these problems much more fixable and much more manageable, so that hopefully people can not be dealing with these longer-term issues of having numbness, tingling, leading to pain down the arm, and eventually leading to weakness either of the arms or the legs.
And I imagine that makes for better recovery times as well.
I tell people, back surgery or neck surgery used to be a big deal in the 1980s and 90s, but also look at where your cell phone was in 1980s and 90s. If you guys remember,
Right.
You had a cell phone that was a big brick or like a backpack attached to it, and just like your cell phones have gotten better and better, the surgical techniques have gotten better and better. And no matter how good the surgical techniques are today, no matter how good your cell phone is today, you can imagine in 2 or 5 years it's going to be better and better. So the technology platform keeps advancing, and the good news is people are living longer and longer. They demand a much more active quality of life. They're not willing to deal with these lingering chronic issues anymore, so the bar is getting higher and higher. The good news is the technological advancements across all of medicine, but especially orthopedics and with spine care, are also trying to keep up.
That's outstanding, and I'm sure you can put all of them to use at Morris Hospital Orthopedics and Sports Medicine.
That's what we're here to do. I think
Right.
that the good news is that we have a lot of treatment options besides surgery. Surgery is always a last resort, and a lot of people have not fully exhausted all the non-operative treatment options, and that's what we try to do here at Morris Orthopedics. We try to really use all of those techniques, whether it's physical therapy, chiropractic care, non-narcotic medications, cortisone shots, etc. And then finally, when all those things have been exhausted, then we try to find the most minimally invasive spine surgery to fix the problem if that's what it takes.
To learn more about Morris Hospital Orthopedics and Sports Medicine Services, locations, hours, and providers, go to morrishospital.org. Click on the Healthcare Centers link. You can request an appointment for Dr. Ali online or call to schedule an appointment at 815-942-4875.